Hi, I'm Nadine Thornhill, sexuality educator, and welcome to You Ask, I Answer, where I answer your questions about sex and sexuality. So if you were here for last week's episode, you'll know that we had this question about sexually transmitted infections. How do you know you have an STD if you have no symptoms? Last week we talked about sexually transmitted infections in general. We talked about where to get tested, why testing is important, and about the fact that sexually transmitted infections may or may not have obvious symptoms. This week, I'm going to get more specific. I'm going to talk about each sexually transmitted infection, what the symptoms can be if there are any, what treatments are available, and also what the outcome may be if you don't get treatment. So if you're having any kind of partnered sex, and by partnered sex, I mean any kind of licking, kissing, sucking, rubbing, penetration of another person's vagina, their vulva, their anus, their penis, their balls, any kind of sex with another person, you do have some risk of contracting a sexually transmitted infection. And the only way to know for sure whether or not you or your partner has a sexually transmitted infection is for you to get tested. STIs fall into three main categories. There are bacterial infections, there are parasites, and there are viral infections. So we'll get it rolling by talking about bacterial infections first. And the first bacterial infection we'll talk about is chlamydia. So for folks who have chlamydia, up to 50% of people born with penises and 70% of people born with vaginas won't have any symptoms of the infection at all. When symptoms of chlamydia do show up, the most common are a cloudy white discharge from the penis or the vagina, pain when you have to pee, having to pee more often, vaginal pain during penetration, or fever. So chlamydia can be cured with oral antibiotics. If you leave it untreated, it can lead to infertility, more often in people who are born with uteruses, but it can lead to infertility in people born with testicles and penis as well. The next infection we'll talk about is gonorrhea. Gonorrhea is one of the most common sexually transmitted infections in the world. It's actually very similar to chlamydia in that a lot of people who have it don't have any symptoms, and up to 50% of people will not have symptoms, and that's for people across the board, regardless of the genitalia or sexual organs you have. When people do have symptoms, again, they're very similar to the symptoms of chlamydia. There is a discharge, but the discharge tends to be more green in color as opposed to white and cloudy. Burning when you pee, having to pee more often, fever, pain during penetrative vaginal sex. Gonorrhea can also be cured through an oral antibiotic, and if it's left untreated, again, like chlamydia, it can lead to fertility problems or infertility. Next we have syphilis. So syphilis has symptoms that come on in stages. The first stage is often the appearance of a painless sore or a canker, and the sore can be on the genitals or inside the mouth, but sometimes it will pop up in other places on the body, and because it's painless, sometimes people won't actually notice it's there. Now, after a few weeks, the sore will usually clear up and go away on its own. The second stage usually comes on a few weeks after the first stage, and it involves getting a rash. Now, again, the rash can be in different places. A lot of times it's on the hands and the feet, but again, it can be more global than that. It can pop up on different parts of the body, and then the rash will eventually clear up on its own. Some people in second stage syphilis also have a mild fever, and because syphilis can attack the nervous system, some people have symptoms like a mild ringing in the ear, or they'll temporarily have vision problems like blurry vision. So what's interesting about syphilis is that usually the symptoms of the second stage will also clear up and go away, and then the infection goes dormant in your body. And what that means is that it's not going to give you any symptoms at all, and it can stay dormant in your body for years and years and years. Now, you won't be feeling any symptoms, but the infection is still in there. So the treatment for syphilis is usually an injection or sometimes several injections of an antibiotic, and as long as you get this antibiotic within the first year of contracting syphilis, then you can cure the infection. Left untreated, Syphilis will stay in your body, and after having remained dormant for years and years and years, it will start to attack your central nervous system. It can damage your organs, it can cause brain damage, and in some cases, it can actually cause death. And our last bacterial infection is trichomoniasis. Try saying that 5 times fast. Most people just call it trick for short because that's much easier to say. People who are born with penises who contract trick often don't have any obvious symptoms. Occasionally they may have some burning when they pee, but usually that's about it. For people who are born with vaginas, trick can cause a frothy, odd-smelling discharge. There may be itching around the vagina and the vulva, and there can be burning during urination. Trick can be cleared up with medication. If it's left untreated, the symptoms may go away, but the infection will still stay in your body and can still be passed on to other people. It can also increase your risk of contracting HIV or passing HIV along to another partner. Next up are sexually transmitted parasites. Our first parasite is crabs, also known as pubic lice. Crabs are little bugs that live in and around the pubic hair, and they bite you and cause all kinds of unpleasant itching. Anyone who's sexually active can get crabs. It doesn't have anything to do with how hygienic you are or how clean you are in your home. Crabs are just one of those things that kind of live in our world, and they can get in our pubic hair. They can be cured. You can get a special medicated shampoo from the pharmacy. Left untreated, crabs aren't a direct threat to your health. However, the itching can be really intense, and if you're scratching a lot, you can develop a secondary skin infection if you have a lot of open skin and scratches. The other sexually transmitted parasite are scabies. Now, scabies are tiny little spiders, and what they will do is they will lay eggs just under the surface of the skin in your pubic area, and then those eggs will hatch and little mites will come out. The most common symptom is a lot of itching. You may also have some red streaks, which are caused when the mites sort of burrow up from under the skin and hatch at the surface. So you can cure scabies with a special topical cream. Left untreated, scabies, unlike crabs, can actually spread to other parts of the body and again can cause a lot of really intense itching and may lead to a secondary infection, again, if you're scratching a lot and breaking the skin. And finally, we have viral infections. Now, the first viral infection is hepatitis, and there are actually 2 strains of hepatitis. There's hepatitis B and there's hepatitis C. Hepatitis are viruses that attack the liver, but they often don't cause a lot of symptoms. So people with hepatitis C can go 10 or 20 years before they develop any symptoms, and people with hepatitis B may never develop any symptoms at all. If someone does have symptoms, they can include things like fatigue, nausea, jaundice, which is when the skin or the whites of the eyes start to appear yellow. They may have darker color pee, and sometimes they'll experience abdominal pain. Some people who contract hepatitis can fight it off naturally. It's more common with hepatitis B than it is with hepatitis C. There's no treatment for hepatitis once you have it, but there are vaccines that you can be given that will prevent you from contracting hepatitis B or C in the first place. If the body isn't able to fight it off, over time, hepatitis will lead to liver damage. Sometimes that damage can be serious and include liver failure or liver cancer. Next is herpes. Herpes is a really common sexually transmitted infection, and a lot of people who have it never have any symptoms at all, and they never know that they have it. When people do have symptoms, usually it's an outbreak of blisters in the genital area. The blisters can be fairly painful, and an outbreak can happen once, it can happen a few times, or it can happen several times over a person's life. Once you have herpes, there is no cure, but there are medications that you can take to help control the outbreaks or help manage the pain of the outbreaks if you're having one. Without treatment, people may find that they experience herpes outbreaks more frequently. Also, during herpes outbreaks, people can be more vulnerable or susceptible to contracting other types of sexually transmitted infections like HIV. So let's talk about HIV. HIV stands for Human Immunodeficiency Virus. It's a retrovirus that attacks healthy blood cells in the body and weakens the immune system. HIV is a little like syphilis in that it progresses in stages. So the first stage usually happens about a week after the infection has taken hold in the body, and it can include symptoms like a low-grade fever, muscle aches, and sometimes people will get a rash. Now, these symptoms usually clear up on their own, and then we go into the second stage of HIV, which is called the latent stage. In the latent stage, the infection doesn't cause any symptoms at all, and this stage can last anywhere from a few years to over a decade. HIV can't be cured, but it can be managed with drugs called antiretrovirals. So for people who detect their HIV early and start treatment early, they can actually live very healthy lives for several decades with HIV. Without treatment, HIV will progress to its late stage, where the immune system becomes too weak to protect the body from infections. This late stage of HIV is known as acquired immune deficiency syndrome, or AIDS. The symptoms of AIDS include having multiple infections, cancers, high fever, lesions on the body, rashes, and rapid weight loss. Unfortunately, AIDS is almost always fatal. Our last virus is the human papillomavirus, or HPV. Now, HPV is an incredibly common sexually transmitted infection, and if you've had partnered sex, there's a good chance that you either have or at some point had HPV. There are a lot of different strains of HPV, and depending on which one you have, you may not have any symptoms at all. There are some strains of HPV that will cause something called genital warts, which are bumps that can appear in and around the vulva or the penis. Now, it may just be one bump, it can be a cluster, they can be different colors, and the bumps can be itchy or sore. There's no medication to cure HPV, but oftentimes the body will flush the infection from the system after about 2 years. There are also vaccinations that people can take before they become sexually active that can stop them from contracting certain strains of HPV. While some strains of HPV will go away on their own, other strains will linger in the body and they can cause repeated outbreaks of genital warts, and other strains of HPV can cause abnormal pap smears by altering the cells in the cervix, and some can actually lead to different types of cancers. All right, so that is it. Those are the STIs and their symptoms. So I really want to say thank you to the person who sent in this question because it's a really important topic. And if you have a question for me, you can write me here on my Facebook page. You can find me over on Twitter at Nadine Thornhill, or you can always get in touch through my website, nadinethornhill.com/contact. Have a great week, and I will see you soon. Bye. Oh, P.S. April is STD Awareness Month, and if you're on Twitter, you can check out the hashtag #ShoutYourStatus to connect with other people who are having great conversations about sexually transmitted infections and trying to reduce stigma around sexually transmitted infections. So yeah, check it out, hashtag #ShoutYourStatus. Bye.